Hey everyone, I'm Brittany Skyler and today is Tuesday, June 3rd. You're now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. If you've been sneezing, sniffling, or rubbing your itchy eyes more than usual this spring, including myself, this makeup does wonders. You're not alone. Experts say this year's allergy season is among the worst on record. Warmer temperatures and higher carbon dioxide levels are extending pollen seasons and increasing pollen production, making symptoms more severe. Here to explain more is Dr. Jane Liao, an allergist with Montefiore Health System. Doctor, thank you so much for joining us today.
Hi, Brittany. Thanks so much for having me.
So let's get into this matter of allergy season. Like I mentioned, so many people, including myself, are complaining that it is worse than ever. I mean, in some seasons, you're able to take medication ahead of time, or you're maybe able to take medication once the symptoms arrive. But now this season, it's just been worse than ever. So can you tell me what exactly is making this particular year so intense?
Yeah, again, thanks for having me. I'm happy to talk about something I'm so passionate about. Every year we hear patients say that, this year is the worst ever. And really there's multiple factors. And the most well known include weather related climate driven changes like more pollen being produced, warmer weather, longer duration of allergy seasons, and higher allergenicity of those pollens, and air pollution as well. But, there's been so many research being done in this area, and there's a lot more to come. So this is just one part of the reason.
Yeah, absolutely. And not only is this year so intense, but it started a little earlier as well. So can you tell me what particular factors contribute to this early start of the season, and what are some ways that people can get ahead of it?
Absolutely. Great question. So, we know that allergies can affect a lot of people. And according to the CDC, we know that up to 30% of our general population experience allergic conjunctivitis, which is eye allergies, and even more are affected by allergic rhinitis or hay fever. And as we mentioned before, climate is a big reason. And climate change may cause shifts in precipitation, warmer air temperatures. The warming weather is causing allergy seasons to start earlier and last longer. And we know that these days the seasons are up to 30 days longer than they were 10 years ago in certain places, which is just crazy to think about. We typically say that spring is tree season, summer is grass season, and fall is weed allergy season. But with the change in climates, the seasons are all blending together and stretching out. So it's not as clear cut anymore. So tree season may drag out longer than March to May, and spring can occur a little bit earlier if the weather gets warmer, resulting in the earlier onset that we all feel. And so, if residents know that a particular season bothers them most in past years, it's best to see an allergist way before that season gets here so they can get testing done in advance so they can prepare.
Thank you so much for sharing that. And now I want to jump into the idea that there have been so many articles highlighting the warmer temperatures and increased CO2 levels, extending the growth of the season and intensifying pollen production. So how have you observed these changes affecting allergy patterns in the Bronx and surrounding areas?
Yeah, I have definitely seen this impact our local population here in the Bronx. We know that climate change can cause fewer frost days and increased carbon dioxide levels in the atmosphere. And increased CO2 can increase plant and flower growth and directly induce them actually to produce even more pollen. And the pollens that are produced are more allergenic as well. So the combination of all of this is becoming more troublesome for our regular allergy patients, but then also people with respiratory conditions like asthma, because the nose and the lungs are a single unified airway, so everything can be affected.
Yeah, I mean, like I mentioned earlier when I was introducing this segment, for myself specifically, it has been so bad. And I know a lot of people, they're like, I'm waking up and they feel like they have dust in their face and dust in their chest.
Yeah.
Now, tell me, and from your perspective, how does the urban setting of the Bronx, pollution and urbanization contribute to more potent reactions?
Absolutely. There's actually a lot of studies done in this in the past. We know that air pollution from things like ozone, sulfur, nitrogen compounds, they can all cause breathing problems. And when
Mhm.
people have allergies, their symptoms become even worse. And the pollution can make the pollen more potent. Smoke from wildfires, as we've seen in LA, can affect the respiratory lining and affect asthma and allergies. And in urban cities, changes to landscape can also create a more favorable growing habitat for certain plants. And inner cities, we know, are warmer in general than suburban and rural areas, and they experience more pollutants and CO2, worsening the effect of the allergies. And like I said, over the years, there have been many studies on how aero allergens affect patients with respiratory diseases in inner cities like the Bronx.
Mhm.
And actually, in 2009, there was a big multi-state studies, including Montefiore, who have looked into over 1,700 kids aged 5 to 11 with asthma, and they found that Bronx children were significantly more likely to be sensitized to those reported aero allergens in the homes than kids from other inner city areas. And more Bronx parents reported household presence of cockroaches and mice and rats. And these parents also had a higher level of psychosocial stress. So, all of these findings suggest reasons for poor asthma control in these kids and identified areas for intervention. And recognizing these areas, we as a community have done better since then, but we can still do more.
Yeah, absolutely. Now, you just mentioned Montefiore looking into specifically children in the Bronx and other patients. And so, approximately 80 million Americans suffer from hay fever. So, tell me, this season, are you seeing an increase in patients looking for treatments, or is it the same amount?
Yeah, absolutely. Especially it starts with the spring season, right?
Mhm.
During these allergy seasons, I've seen more same day appointments, more people needing environmental allergy testing, and even more established patients who become uncontrolled on their first line therapy regimens. And they actually need to go to immunotherapy or allergy shots. So, for sure, we've definitely seen that.
Mhm. And so many adults are developing allergies later in life, which I know so many are, kind of confused. It's like maybe if I was born with it, and then if you didn't have it in adolescence, then you expect to not have it as an adult. But now we're seeing this happen. So tell me, what factors do you believe contribute to this trend, and how can individuals manage their new or worsening symptoms?
Yeah, also a great question. So I think this is probably due to a combination of ongoing environmental exposures, changes in lifestyle, and evolving immune responses. New onset sensitizations to allergies we know can occur in adulthood, and this process again, is influenced by the changing exposures to allergens, air pollution, urbanization, which can all modify your immune tolerance and promote sensitizations even after childhood. We also know that Western lifestyles and modernization, for example, increased time indoors, reduced microbial exposures, are associated with higher prevalence of allergic diseases in adults in general. And climate changes, as we've mentioned before, have extended the pollen seasons and increased the allergenic potential of the pollens, all further, increasing the risk of new allergy onset in adults.
Thank you for sharing that. And so I want to kind of go back to what we mentioned at the top of the conversation is that allergy season is starting a little earlier than normal, but in that many professionals recommend that you start taking your medication about 2 weeks before the season, which is something I'm very guilty of not doing. No matter how many times they suggest it, it's always one of those. And I'm like, I will wait until I feel the first symptom. So can you please elaborate on the importance of early intervention and how that's going to help you through the allergy season?
Absolutely. So, allergy seasons can have a huge impact on quality of life.
Mhm.
And most people say, it disrupts sleep, which can contribute to fatigue and stress. And this is especially for kids, right? Which are really frustrating for the parents who, because the kids have to miss school because of the severity of their symptoms. And one thing I always tell my patients is to understand the timing, like you suggested, of when to take their allergy medications because some oral allergy pills will work right away, but intranasal steroid sprays, which are more effective than the pills, tend to take at least 1 to 2 weeks to reach their maximum potential. So, starting the nasal sprays a few weeks before the allergy season will help prepare them. But if their allergy or current allergy regimen is not working, then the best thing to do is to see their PCP or allergist, right away to make modifications to their medications.
Absolutely. I'm most likely going to take the advice now. I haven't taken it for years, but
Mm.
after speaking with you, I most likely will. So tell me, are there any local resources or strategies that people can use to combat their symptoms?
Yeah, I always recommend my patients to check the pollen levels before they
Mhm.
go outside to try to avoid times where the pollens are at their peak. Routine spring cleaning, air purifiers, changing clothes before coming indoors, taking a shower after significant time outdoors can reduce continued exposure to the pollens. And if people know that they're allergic to their pets, they can consider giving their pets a bath after spending significant time outdoors during those high pollen days.
And are there any treatments or things that you can do to alleviate symptoms at the moment right away?
Yeah, I would say if you are currently working with an allergist, they know you the best and will be able to give you the most personalized advice. So definitely talk to your friendly neighborhood allergist. If you currently don't have an allergist, you could consider looking into over the counter options like the allergy eye drops. Nasal sprays and the allergy pills. However, I would also recommend to see a primary care physician right away so they can get evaluated while waiting to see an allergist to get tested so they know exactly what their triggers are.
Dr. Liao, thank you so much for sitting down with us today. Like I mentioned, this allergy season has been so bad. So thank you just so much for informing us and just giving us different ways that we can combat these really annoying symptoms.
Absolutely, my pleasure. Thanks for having me again.
So to keep up with Montefiore Health System, please visit the website on the screen below. Don't go away. We'll be back with more open right after this.